EP 39, How to Protect Your Hearing After 60. Hearing loss is the third most common chronic condition in older adults, behind only arthritis and high blood pressure. Nearly 2/3 of adults over 70 have significant hearing loss. And yet, only 1 in 5 people who could benefit from a hearing aid uses one. This is a significant problem, not just for communication, but for overall health. Untreated hearing loss is one of the strongest modifiable risk factors for cognitive decline and dementia. It is associated with depression, social isolation, increased fall risk, and significantly reduced quality of life. Understanding why hearing declines, how to protect what you have, and how to address loss when it occurs is genuinely important health information. Today, we're covering all of it. The most common form of age-related hearing loss is presbycusis, a gradual, progressive decline in hearing sensitivity that typically begins in the high frequencies and progresses to affect mid and lower frequencies over time. The primary cause is the loss of hair cells in the cochlea, the sensory cells that convert sound vibrations into electrical signals sent to the brain. Unlike the hair cells in other species, human cochlear hair cells do not regenerate. Once lost, they are gone permanently. Hair cells are damaged by cumulative noise exposure. This is the largest preventable cause of hearing loss at any age. They are also lost through aging-related metabolic changes within the cochlea, vascular changes that reduce blood supply to the inner ear, genetic predisposition, and ototoxic medications, drugs that are toxic to inner ear structures. The auditory nerve and the brain's auditory processing centers also change with age, reducing the ability to process rapid speech even when sound detection remains adequate, explaining why many older adults can hear that someone is speaking but struggle to understand the words, particularly in background noise. Noise-induced hearing loss is cumulative and entirely preventable. Sound is measured in decibels. Sounds above 85 decibels cause cochlear hair cell damage. The damage depends on both volume and duration of exposure. A normal conversation is about 60 decibels. Traffic is 70 to 80. A lawnmower or power tools, 90 decibels, enough to cause damage after 2 hours. A rock concert, 110 to 120 decibels, damage within minutes. Hearing protection, foam earplugs or earmuffs, should be used for any sustained exposure above 85 decibels. Power tools, lawnmowers, leaf blowers, loud music, sporting events, and concerts all qualify. Headphones and earbuds. The WHO estimates that 1 billion young people are at risk from unsafe listening practices. Adults over 60 grew up at an era of louder environments, and many have decades of cumulative damage. The 60-60 rule. Listen at no more than 60% of maximum volume for no more than 60 minutes at a time. Better yet, use noise-canceling headphones. These allow you to hear clearly at lower volumes by reducing background noise rather than compensating by increasing volume. Ototoxicity, drug-induced inner ear damage, is an underappreciated cause of hearing loss and tinnitus in older adults. Medications with established ototoxicity include loop diuretics, furosemide Lasix, particularly with high doses or intravenous use. Aminoglycoside antibiotics, gentamicin, tobramycin, commonly used for serious infections. Platinum-based chemotherapy, cisplatin and carboplatin, cause hearing loss in a significant proportion of patients. High-dose aspirin and NSAIDs, prolonged high-dose use can cause temporary or permanent tinnitus and hearing loss. Quinine, used for malaria and leg cramps. If you take any of these medications and experience new hearing loss or tinnitus, report it to your doctor promptly. In some cases, dose adjustment or alternative drugs can prevent further damage. The cochlea is highly vascular. It depends entirely on a rich blood supply to function. Conditions that damage small blood vessels, hypertension, diabetes, smoking, and cardiovascular disease directly impair cochlear function. Studies consistently show that cardiovascular risk factors correlate with worse hearing outcomes. People with well-controlled blood pressure and blood sugar, who exercise regularly and do not smoke, have measurably better hearing for their age than those with poorly controlled vascular risk factors. This means that the lifestyle interventions for cardiovascular health are simultaneously investments in hearing health. Another reason that diet, exercise, blood pressure control, and not smoking pay dividends across multiple systems simultaneously. Tinnitus, the perception of ringing, buzzing, hissing, or other sounds without an external source, affects approximately 15% of adults and is much more common in older adults with hearing loss. It is rarely a sign of anything dangerous, but can be significantly distressing. Tinnitus is most commonly caused by noise-induced hearing loss, the brain compensating for reduced cochlear input by increasing its own spontaneous activity, which is perceived as sound. It can also be caused by certain medications, earwax buildup, ear infections, cardiovascular conditions, and temporomandibular joint disorders. Management options include sound therapy, using background sound to reduce the perceived contrast of tinnitus; cognitive behavioral therapy, which is the most evidence-based psychological treatment for tinnitus distress; hearing aids, which help by amplifying external sounds and reducing the tinnitus-to-signal ratio; and in some cases medication for associated anxiety or depression. If tinnitus is new, sudden, or in only one ear, see an audiologist or ENT promptly. If you have hearing loss, hearing aids are the most evidence-based treatment available. Modern hearing aids are dramatically more capable than devices from a decade ago, far smaller, smarter, and with Bluetooth connectivity, rechargeable batteries, and AI noise processing. Studies show that hearing aid use significantly reduces the risk of cognitive decline in people with hearing loss, one of the most compelling findings in dementia prevention research. Hearing aids also reduce depression, improve social engagement, and improve functional independence. Since 2022, over-the-counter hearing aids have been available in the United States for adults with mild to moderate hearing loss, substantially reducing the cost barrier that prevented many from seeking help. If you suspect hearing loss, your family is often the first to notice. See an audiologist for a full hearing assessment. Hearing connects you to every conversation, every relationship, every moment of music and laughter, protecting it through noise hygiene and cardiovascular health. And addressing loss when it occurs with modern hearing aids is one of the highest return investments you can make in your quality of life and your cognitive future. Don't wait. If you suspect hearing loss, get tested. And if you need hearing aids, use them. See you in the next video.